All right, this around. Let's get this set up. Good morning. Hey, Ohio. Is that Ohio, like Ohio, the state? How are you guys? So this is Dr. Thomas. Let's see. There we go. Maybe I can get it right here. Pull that up. Hey, Ryan Nero. Where are you from, man? Morning, I have Black Knight. What's up, guys? Good morning. This is Dr. Thomas. Dr. Darin in Spandex. Good morning, DLDF. Always happy 9023. I love it. I love that mantra. Okay, so here's some things. 5 topics we might maybe get to, maybe not. Dolez 99. Where are you from? Good morning. Hey, so this is Dr. Darin. I am a family physician in Illinois, and I just like to talk about anything I can talk about and say good morning. Voyeurisk. Hello. Where are you from? Oh, Gizman 135. Oh, I forgot where you're from. I think you're from Turkey. Well, good morning. Heli. So, we are greetings from San Francisco. Shoot, man, that means you're either up really late or if you're up really early. Hey, Buzan. All right, good morning. So, 5 topics in 15 minutes, or we'll just shoot the breeze, whatever you're. I love your doctor. I love your doctor. I don't know. Maybe you're saying I love you. Hey, TNSLN. Good morning. So, failure. Failure is a mindset, right? So, good morning, MGINS. Where are you from? So I am from Oregon. That's where I'm from. Anybody in Oregon? AMU, INOMFP. Man, all these usernames, they're S59s. So failure. Failure is just a decision to quit. It's a decision to live your life based on the standards of other people, and don't do that, man. Jihindo, come on. So, man, if I'm too close, MMAJNK. If I'm too close, I can't read. You can't see the spandex or the board. Okay, say failure. Just don't give up, man. Chinese proverb, right? Fall off the horse 7, get up 8. Okay, just do it. Shia Alley Cat 650. I don't know if he said it or if he just copied it, whatever, but Nike. Cal Naughty said for us, how are you? Dr. Darin, this is my Doctor in Spandex little session. Okay, so failure, we've covered that. Don't fail, don't quit. Matthew B, 635-12830. What a doctor, what doctor? Anyways, Frozen for Blade. Anyways, so failure is not an option, right? So Frozen for Blade, and we're losing. So what I like to talk about, number 2, heart attack. So if you came to EMS and you called EMS 911, hey, I'm having chest pain, might be having a heart attack, I'm worried. Sally Stratton, forever cool dude, what's up? Hey, if I'm having chest pain and you're worried about it and you go into the ER, so this is what they're going to do. They're going to work up what we call an ACS protocol rule out, okay? Acute coronary syndrome rule out. Hey, Kim Hanlam. Okay, because we have to cover your butt. We've got to make sure that you're not having a chest pain or not having a heart attack. So we do serial EKGs and serial troponins, okay? Every organ in our body spits out these proteins and these little markers, okay? And they tell us a story. Hey, Trabesk, 2010, you kind of look like Chris Pratt. Sweet, you told me that yesterday, or someone did, and I appreciate it. That's awesome. 00 Arif, 00, Semasa Ere. Thank you. That's cool. I wish I have a cough that has not stopped for weeks. How do I get rid of it? Okay, so there's a lot of reasons you can have cough, right? So you can have an infection, bronchitis, esophagitis, right? Bronchitis could last a long time, but you need to see a real doctor because he's got to take a picture and he's got to look back in there and he's got to take a light and he's got to ask you some questions. Silver Murmurous, hey, join. What's up, Marmis? And anyways, you could have postnasal drip. Postnasal drip is when you have like sinus infection, and then right back here, the sinus infection drips on the posterior side of your throat, and it tickles your throat, and it just coughs and coughs and coughs. Never goes away. Annoying. On average, how much meth is too much meth? On average, any meth is too much meth. Okay? If you ever want a motivation to stop meth, Google before and after pictures of meth addicts. You have a normal person, meth addict. Okay? Losing teeth. My favorite doctor's back. Sweet! I love it. Okay, I had a cough for weeks and ended up being pneumonia. Absolutely. Coughs can be simple. Coughs can be very problematic. Okay, big spectrum, right? Cough simple, cough problematic. Beep. Okay, Charlie 2501. I missed a couple people. Hey, can porn cause erectile dysfunction? Okay, pornography can increase. It changes, man. Okay, so you got the brain right here. Brain right here. Okay, right up here, you got this reward center. Okay. Every time you watch porn, it stimulates that reward center. It lowers the amount of satisfaction you get, okay? So every time you watch porn, you can lead to erectile dysfunction. So answer is yes, okay? It can lower your the needed stimulation to get aroused, okay? Tien Boiler, okay, good morning. So, no bueno, okay? There's a whole slew of information about porn, okay? Group I like to fight is called Fight the New Drug. Pornography is an addictive drug, okay? And it can be damaging, and it can destroy relationships. A lot of people make the argument that it can be constructive relationships. Possibly, but that's a minority. Damn, you're dope. Gonna follow. Hey, thanks, man. Okay. So, brain. Okay, we did heart attack, chest pain. Oh, so many things chest pain. Okay? As a doctor, we got to make sure you're not dying on us. Are you a qualified doctor? Yes, I'm a DO, which is a doctor of osteopathic medicine. It is, you have MD, DOs. We're the same thing. We practice the same thing. It's just like Ford versus Dodge, right? Okay, so if those things come back on a heart attack right there. Okay, if those things come back and they're negative, sometimes we can't rule out everything, okay? And there's no point in you staying in the hospital for all that time. But what we do know is that you don't have a heart attack. I have the flu, pounding headache. Man, I'm sorry. So pounding headache, another thing, a big old slew. You can have withdrawal. You can have sinus infection. You can have migraine headache, tension headache, rebound headache, cluster headache, so many things. Flu symptoms, okay? If it's a virus, which is most likely flu, it'll last 7 to 10 days, okay? You should be feeling better within that time. If you don't, then you need to go see a doctor, okay? If you see any symptoms where it's super elevated temperature and things are changing, altered mental status, you start feeling weird and confusion, get to the hospital. It's cold in New Zealand. I think it's flu. Possibly. It's actually a myth that the temperature causes flu. You know, mom would go out there and say, put a jacket on because you're gonna get sick. That's a myth. That is not true. Okay. The reason why flus are associated with cold season is because people stay indoors, and there's more people in a congested area. Okay, and so that's easier swapping of aerosols product. We cough, we shake hands, we play more inside, and it's virus induced. It has nothing to do with the temperature. Okay, flu versus cold. Okay, both viruses can be caused by different types of viruses. Colds, okay, are a bugger. There's no antibiotics for it. We just chase it morphs so quickly we can't catch up to it. What about Mexican mid of not showing when you're sick? Man, I'll repeat that. I didn't catch it. Something about Mexican mid. Something about when you're sick. Maybe Hispanic panic. Is that what you're talking about? Oh, why do autistic children have digestive systems? Hope you do not stop doing what you're doing because you're the best at it. Sweet. Hey, thanks. I appreciate it. Okay. Dennis Parr, good morning. And Berg Bray 47. Thank you. So, autistic children, digestive system. Okay. Autistic children have different genetic deformities that cause these issues that we have. Okay. Autistic, there's a whole spectrum. Okay. Hello, doctor. Texting from India. What's up? I love India. My roommate in college was from India. His name was Rajiv. And he would always say, boom, Darin. But he was super skinny, and he always tried to tackle me. He taught me how to, I think it's called bowl, right? Like that. Was that good, India people? I love to learn how to play cricket. And I love that cricket is on ESPN now. How cool is that? The Mexican myth of not showering when sick. You know, I've not heard that one. I don't know. Cricket bowl, yes. So Homerero M. So, okay. So I do not heard. No, I have not. I'm gonna learn about that Mexican myth of not showering. There's a lot of wives' tales and things that we do culturally. And you know what? I'm not against them, because a lot of the times they actually can work because the placebo effect is so powerful, right? Hey, JSM bueno, que bueno. I think shower for 6 days. It was rough, man. I am a clinical coordinator for renal division in India. Hey, hats off to you. That's awesome, man. Keep it up. Just do the best whatever you do. Sick broski. I'm allergic to pollen. Blocked sinuses. Dude, sinus infections are the worst. They just come and they come. No relief. There's so many things. Are you excited that a doctor might be a future president? Ben Carson. I think it would be awesome to have a physician, because there's a lot of problems with medicine and politics and medical decisions being decided by politicians that have no idea about what a patient needs. Hey, doc, can you make a shout out to my friend Mal in New Zealand? Hey, what's up, Mal? How are you? Hey, if I ever go to New Zealand, I need a couch. Me and my family, we're going to come and visit, all right? I'd love to come see you. When I go to vacations, I stay away from all the tourists. I don't like going to where the tourists live. I don't go on too many vacations, but when I do, I like to go with the locals. So I like to stay with families that have their type of food and say, hey, where do you like to hang out? Yep, I get a sinus infection when I diet. Real talk. I'm not sure. Diets. I don't like the word diet. I don't know if that's what you're going for. Sinus block. Sinus block. CHS-FALI. Hey, what's up, man? Sinus block is a terror. You know what one of the best things for sinus blockage is? It's called the neti pot, okay? It's basically this little water plant plastic thingy that goes up your nose, and you go like this, and you pour it in the nose, and it comes down like this, okay? It's not a medically prescribed thing. You just go pick it up at the store, but it does great things because it has saline, okay? The saline dries it out, and how do you retain all the information that you study while you're in school? Impossible to retain all the information. There's so much crazy information. Do you practice peritoneal dialysis or hemodialysis? Yes. Hemodialysis, yes. I probably got the last one. It works great. It does. What are the chances of me having heart problems? My mom had a triple bypass at 47. Dad died at 41. How old are you? Okay. Every time you have a heart problem, a direct family member that is in your family that has a heart disease, you increases your problems of heart disease exponentially. 34. Okay, so 34. You're not too stressed, but you need to have your risk factors. Do you believe in God? I do believe in God. I'm a member of the Church of Jesus Christ of Latter-day Saints, or aka Mormone. I'm a Mormon. I died in the bull, through and through, okay? And I'm married. I have 3 children, and I love my life. I'm a very blessed guy. Okay, so heart risk question, okay? Coming back, so you have 34 years old. So you're a woman, 34 years old. So your risks are lower because of those 2 classifications. Marmana. Okay, most serious patient case you've dealt with. My very first patient was a child. I caught the baby. Most serious respect, man. You probably made a sweet missionary. Hey, thanks, man. I appreciate it. Mormon, LO, you're the best. What inspired you to be doctor? You know, I kept on going. I always joke that I didn't want to get a real job because I just wanted to keep on going to school, right? Boom, 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 boom. So, but really, I love the human body. I kept on wanting to study more and more and more about the human body. Okay? Speaking about the body, human body, anybody see VMA? I saw on there the VMA, and I put on the dress code. Hey there, Alika. What's up, man? So I put on here the one thing I want to talk about, VMA dress code. What has happened to our dress code? Can you pray for me, please? Absolutely. This is CHZZ Afale. Okay, absolutely. I'll keep you in my mind, man. Whatever you're going through, just keep fighting, right? My last topic, fight, grind, repeat. Okay? Life is tough, okay? Don't let anybody else tell you. I'm 22. My LDL is 251, no other problems. Am I in trouble? LDL being 251, no bueno. Okay, you need to get on a statin. Okay, did you meet anyone in med school that dropped out? Yes, quite a few people that dropped out. Okay, VMA's crap. Okay, I didn't watch it. I just saw the feed of it, but I was completely disappointed with the dress code. Man, this is our dress code standards in the world. Okay, we used to be classy. Okay, okay. Down. We're just dropping. I amazingly am in love with the human body, okay? As a man, I'm amazingly in love with the female human body, okay? It's genetically built in us, okay? But you can put parameters of control and restrict, okay? I'm married, and so average recovery time of total hip replacement, I hate missing work. Okay, it depends on your age. If you're over 50, it's going to be a while, okay? If you're young, it can be fairly quick, okay? Do what your doctors tell you to do. Crap, I gotta go, 45 minutes. Okay, you're 45, okay? So listen to your physician's recommendations of your orthopedic surgeon and listen to PTOT, okay? Don't be proud, okay? Don't try to bug it and hit it too fast, okay? Because you can do more damage than is good. Okay, you gotta be patient. Okay, last one, POLYPHARMACY. Okay, do you prefer PNA, NP? Physician assistant or nurse practitioner, both rock. You know, different people, different pathways, still learning the same medication. Depends, and they have different parameters in different states. Okay, people use MTV for fashion trends. I agree, man. But see, what Miley Cyrus wore was not a fashion trend. It was straight porn. It's soft porn. How do I reduce my LDL? Okay, diet and exercise have shown that you moderate reduction in LDL, but you got to get on a medication, okay? It's just crazy. My mom has problems with her thyroid and her hair starting to fall. Well, I have the same problem. Okay, hyperthyroidism can cause hair falling out. You can get it tested and you can monitor it, okay? There's things that medications you can help lose weight fast, okay? There's crash diets all over the world, but you can't lose weight fast, okay? You don't gain weight fast. You can't gain weight fast. Well, you can, but it starts off with water weight and quick fat adipose, but it will come back, okay? You'll do this yo-yoing, yo-yo-yo-yo-yo. gain weight, lose weight, gain weight. Like, you have to be patient and go down.